FDA. So you just please stay with me. There is a correction in this slide, which I will be explaining it to you now. Okay. So any case that is serious and unexpected adverse drug reaction that is related by investigator, it has to be reported to EU and FDA. So previously, before May 2023, FDA was taking into consideration when it was both related by investigator and marketing authorization holder. That is, if the investigator causality and the sponsor's causality agrees, then we will report to FDA. But there is a change in this guidances after May 2023. So what is that changes? Any serious unexpected adverse drug reactions that is related by investigator, it has to be reported both to EU and FDA, irrespective of sponsor's causality. So that is the change. Okay. So why you have to keep this in mind is that this could be asked in most of the interviews in any scenario based questions. If you are aware of this new guidances where there is a change, you can be able to crack that question. Okay. So I will be repeating this again and you pay attention to this part because this is the most important thing what you have to take for interview sessions. So if it is any serious unexpected adverse drug reaction that is related to investigated causality, then it has to be submitted to EU and FDA irrespective of sponsor's causality. Okay. When it comes to SUSARs, here I need to clarify two things. There is only clinical trial SUSARs. There are no post-marketing SUSARs. Okay, why there are no post-marketing SUSARs is because the patient has taken the drug and he had experienced that adverse event and he will be reporting it. It has its implied causality. So unless otherwise the event is serious, the patient might not have reported. So that's why when it comes to post-marketing cases, there is no SUSARs. SUSARs are only for clinical trials. And SUSAR stand for suspected unexpected serious adverse reactions. Okay. So I hope you are clear with this slide. Next, we will move on to the reporting timelines. So any serious cases that is fatal and life-threatening, that has to be reported within 7 calendar days from IRD, that is initial receive date. Okay. Any serious, non-fatal, life-threatening, non-life-threatening events, that has to be submitted within 15 calendar days from clock start date. So this clock start date or initial receive date, both are same. Once you receive, you have to submit this serious, fatal and life-threatening cases within 7 calendar days. And if it is serious, non-fatal, non-life-threatening, that is, if you have gone through seriousness assessment, it is well and good. If you have not gone through seriousness assessment, the seriousness criteria is for 15 days report include any event that required hospitalization or lead to prolonged disability or damage, or any congenital anomaly or birth defect that has happened because of that adverse event, or any medically significant event or important medical event. So these are the things that will come under serious, non-fatal, non-life-threatening events. Okay. So in these cases, you will be reporting to regulatory authorities in 15 calendar days from clock start date. Okay. Then what you have to remember here is this reporting timelines is for drugs and biologics. So when it comes to devices, this is going to change. Any serious, fatal and life-threatening event that occur due to devices, it has to be reported within 15 calendar days from IRD. And any serious, non-fatal, non-life-threatening, that has to be submitted within 30 calendar days from clock start date. Okay, when it comes to devices, there is a change in reporting timelines when it comes to devices. So if it is devices, it is 15 and 30. And if it is for drugs and biologics, it is 7 and 15. Okay. And next, coming to the exceptions of expedited reporting, as we mentioned the timelines before, there are some situations where you have to report to the regulatory authorities at the earliest, as soon as possible. So these are the three things where you will be doing an expedited reporting within even